All right, so today we are diving into a really kind of a huge topic, actually.
Yeah.
We're talking about the medications that help us fight off those microscopic invaders that, well, frankly, make us feel awful.
Yeah, what viruses.
Viruses, exactly. And you know what's fascinating is like you brought this amazing collection of material and it really
Yeah.
highlights this dual approach, right? It's not just about like going after the virus itself. It's also about working with our body's natural defenses.
Right, exactly.
So we're looking at like how we can boost our own immune systems
Yeah.
and then also how we can just directly attack those viruses when they, when they decide to pay us a visit.
Absolutely, yeah. Your sources really lay out these two core strategies. On the one hand, we've got drugs that kind of act like personal trainers for your immune system. They're either giving it a pep talk to ramp things up or telling it to chill out when it gets a little too overzealous.
Right.
And then on the other hand, we've got these super specialized agents that are designed to like really disrupt the inner workings of specific viruses, messing with their ability to replicate and spread.
So we've got a two-pronged approach here, which is really, really interesting. Now, your sources really lay out these two main categories,
Yeah.
and they start with the immune system itself. It's really amazing the different ways that our bodies naturally try to protect us.
Oh, absolutely.
It's a very complex system.
Yeah, it's a very complex system. And the medications we're talking about today often kind of finesse these natural processes. The sources introduce us to this term immunomodulators, which is a bit of a mouthful.
Yeah.
But essentially, it's the umbrella term for drugs that either increase or decrease the activity of your body's defenses,
Okay.
depending on what's going on.
Okay, that makes sense. So let's like break down the immune system itself a bit more. Your sources talk about this distinction between innate and adaptive immunity.
Right.
What's the key difference there?
Okay, think of it this way. Innate immunity is your body's like immediate general security system. It's that first line of defense, things like your skin keeping those invaders out, or you've got these specialized cells that can basically gobble up and destroy any foreign particles they come across. It's a very blunt instrument. Inflammation and fever are also part of this quick, non-specific response.
Yeah.
Adaptive immunity, on the other hand, that's like a highly trained special forces unit.
Oh, okay.
It's a little bit slower to respond initially, but once it gets going, it learns to recognize specific threats and mounts a targeted attack. This is where the production of antibodies comes in, those like highly specific defenders we always hear about.
Oh, that's really cool. And that kind of ties into active and passive immunity, right? I mean, those are terms that are really important when we're thinking about, how drugs can interact with our immune system.
Exactly. Active immunity is when your body develops its own long-lasting protection by producing antibodies after being exposed to a foreign substance, an antigen.
Yeah.
And vaccines, right. Vaccines are the perfect example
Oh, yeah?
of how we can harness active immunity. They basically introduce a harmless version or like a little piece of a pathogen,
Right.
allowing your immune system to kind of train on it.
Right. It's like target practice.
Exactly, without you ever having to actually get the full-blown disease.
Right. And passive immunity. So that's kind of like you're getting antibodies from somewhere else rather than
Yeah.
making them yourself, right?
Exactly. It's like you're borrowing somebody else's security detail for like immediate protection.
Okay.
So a classic example is when a mother passes antibodies to her baby, through the placenta or breast milk. But there are also medical treatments like immune globulin injections that give you a temporary boost of antibodies. These are particularly helpful for people with compromised immune systems, who can't really mount a strong defense on their own.
Right.
Or those who are at high risk of these nasty diseases like, botulism, tetanus, rabies.
Where you need it like now.
Where you need immediate protection, exactly. The downside is that this type of protection with active immunity.
That makes sense. Now, within this, category of immunomodulators that you mentioned, you have like two subgroups, immunostimulants and immunosuppressants. And I'm guessing one is basically like turning the volume up on your immune system and the other is turning it down.
That's a great way to put it, yeah. Immunostimulants, you'll also see them called biologic response modifiers.
Okay.
These are designed to give your immune system a boost, make it work more effectively. Your sources talk about things like interferons and interleukins as examples. Think of those as like signaling molecules that help different parts of the immune system to communicate and coordinate their attack.
Okay.
These can be used to help the body fight off persistent viral infections, situations where the immune system's not quite up to snuff, and even in the treatment of certain types of cancer.
So basically just giving it a helping hand, giving it a boost.
Exactly.
Okay. And then immunosuppressants. I mean, when would you actually want to do that? When would you want to like kind of suppress or dampen down your body's natural defenses?
Yeah. Well, immunosuppressants do just that. They reduce the activity of the immune system. And this is really essential in situations where the immune system's kind of gone rogue, right? And it starts attacking the body's own healthy tissues,
Oh, okay.
which is what happens in autoimmune diseases, things like rheumatoid arthritis or lupus.
Yeah.
These are all examples of where immunosuppressants are really important. And then, of course, they are critical for the success of organ transplantation.
Right. Organ transplantation, that's, such a marvel of modern medicine.
Absolutely.
And it really highlights why those drugs are so important. Your sources explain how the recipient's immune system sees the new organ as a foreign invader.
Right.
And it just wants to attack it.
Exactly. The transplanted organ, it has its own unique markers called antigens. And the recipient's immune system sees those and is like, whoa, wait a minute, this doesn't belong here. And then it mounts this immune response aimed at destroying that foreign tissue.
And you need those immunosuppressants to stop that from happening.
Exactly, to prevent that rejection and allow that transplanted organ to actually survive and function.
Oh, wow. And your sources even like break down the different types of rejection.
Yeah.
You've got like this rapid antibody-driven response called humoral rejection,
Right.
which can happen like super quickly within days.
Yeah, within days.
Then you've got this slower cell-mediated response, which typically develops in a couple of weeks.
Right, right.
And then there's even this chronic rejection,
Yeah.
which can happen months or even years down the line. Wow.
Yeah, unfortunately.
So it sounds like a very delicate balancing act. I mean, you're suppressing the immune system to prevent rejection, but then doesn't that open the door to other problems?
It absolutely does, yeah. Your sources point this out. Immunosuppressants can have some pretty significant side effects. They can be toxic to bone marrow, which is where our blood cells are made.
Right.
So that can lead to things like anemia or an increased risk of bleeding.
Right.
Because, obviously they weaken the immune system. They also increase the risk of infections.
Yeah.
Right? Because your body is less able to fight off these everyday bacteria and viruses and fungi.
Right.
There's also a slightly increased risk of developing certain types of cancer, like lymphoma.
Okay.
And your sources mention the main types of immunosuppressants, things like corticosteroids, which are those powerful anti-inflammatory agents,
Right.
antimetabolites, which interfere with cell growth and division,
Okay.
antibodies, which can specifically target immune cells,
Right.
and calcineurin inhibitors, which disrupt this key signaling pathway in immune cells. So they all kind of work through these different mechanisms
Okay.
to dampen down that immune response.
That makes sense. Okay, so that gives us a pretty good overview of how drugs can kind of like influence the immune system.
Yeah.
Now let's switch gears and talk about the other major category in your materials, the drugs that actually target viral infections themselves.
Okay, right.
Viruses, your sources explain, they're not really like living organisms in the same way that bacteria are or, our own cells are. They're really kind of these like sneaky little things that invade a host cell and then, hijack its machinery to make more of themselves.
Right. They need a host to survive.
They need a host, yeah.
Yeah.
They're kind of like, intracellular parasites almost.
Right, exactly. They can't replicate on their own.
They need us.
They need us, unfortunately.
And while, our bodies are pretty good at handling a lot of viral infections on their own, like
Right.
the common cold,
Yeah.
your sources emphasize that some of these viral infections can be really serious, life-threatening even, if you don't get specific treatment.
Yeah, absolutely.
So it's not just like a sniffle, right?
No, not at all.
This is like serious stuff.
It can be really serious stuff.
And developing these drugs to fight viruses, that's not an easy task, right? It comes with its own challenges.
It really does, yeah. I mean, one of the biggest challenges is that viruses can mutate so quickly.
Right.
It's this rapid evolution, right? It can lead to drug resistance,
Yeah.
where a drug that was once super effective is suddenly no longer working against this altered virus.
And that's a huge problem, right? I mean, we've seen that with, bacteria and antibiotics.
Exactly.
And I'm assuming it's the same with viruses.
It's the same story with viruses. And another major challenge is the fact that viruses replicate inside our own cells.
Right.
So it's really tricky to target the virus without also damaging the host's healthy cells.
It's like, trying to get rid of a pest in your house without like tearing down the whole house.
It's a great analogy.
Yeah. It's a really tricky situation.
It's a delicate balance.
And your sources note that by and large, like each antiviral drug tends to be pretty specific to a particular virus or a family of viruses.
Right, that's generally true. I mean, there are a few examples of what we call broad-spectrum antivirals, which can work against a wider range of viruses. We'll talk about that a little bit later.
Yep.
But for the most part, we need drugs that are very specifically designed to interfere with the life cycle of that particular virus.
Okay, that makes sense. Now let's zoom in on a couple of specific examples here. HIV/AIDS is covered in, quite a bit of detail in your materials.
Yeah.
Now, HIV is described as a retrovirus. What makes it so unique?
So HIV is classified as a retrovirus because it has this really unusual way of replicating. Instead of the usual flow of genetic information from DNA to RNA
Right.
and then to protein,
Right.
HIV actually uses an enzyme called reverse transcriptase to create viral DNA from its RNA genetic material.
Wow.
It's basically working backward. And then this viral DNA gets integrated into the host cell's DNA, allowing the virus to basically take over the host cell's machinery and churn out more virus particles.
Wow.
And over time, HIV specifically targets and destroys these really important immune cells called CD4 plus T cells,
Right.
which eventually leads to AIDS, which stands for acquired immunodeficiency syndrome.
It's really kind of sobering to think about the impact that HIV/AIDS has had.
It has, yeah.
But your sources also highlight the incredible progress that's been made in treating it.
Oh, absolutely.
I mean, while there's still no cure, the development of new drugs has really fundamentally changed the outlook for people living with HIV.
It really has. People with HIV who have access to modern treatments are now living much longer and healthier lives. The risk of transmitting the virus from a mother to her newborn has been dramatically reduced. And your sources even mention a significant decline in the death rate in the U.S., which is a testament to how far we've come in terms of antiviral therapy.
That's really encouraging. Now, the sources mentioned this latent phase where the virus can be dormant, which I guess is even more kind of insidious, right? Because somebody might be infected and not even know it.
Absolutely, yeah. During this latent phase, HIV is still there in the body, but it's not actively replicating like crazy.
Okay.
Individuals might be completely asymptomatic and feel totally fine. But even during this period, the virus is kind of quietly doing damage to the immune system.
So it's still at work.
It's still at work, yeah.
Okay. And your sources indicate that treatment is typically initiated when a person's CD4 count, which is kind of this key measure of immune health,
Yeah.
drops below a certain threshold. I think it was around 200 cells per cubic millimeter.
Right.
Or if they start developing, symptoms of HIV infection.
Mm-hmm.
But for those with, higher CD4 counts, maybe above 350, the decision to start treatment might be a little more individualized.
Yeah, it really depends on a variety of factors.
And the goals of therapy for HIV, it seems like it's not just about, suppressing the virus.
No, not at all.
It's much more comprehensive than that.
It's really about improving overall health and quality of life. So the primary goals are to reduce the amount of HIV RNA in the blood, which is often referred to as the viral load, to undetectable levels. That not only improves the person's own health, but also dramatically reduces the risk of transmission to others.
Right, right.
Other goals include, increasing lifespan, maintaining a good quality of life, and as we said, preventing mother-to-child transmission.
Right, and your sources introduce HAART, or ART, as the cornerstone of HIV treatment. What does that actually involve?
So HAART, which stands for Highly Active Antiretroviral Therapy,
Right.
which is now more commonly just referred to as ART, or antiretroviral therapy.
Okay.
It involves using a combination of drugs from different classes that all target different parts of the HIV life cycle.
Okay.
So this multi-drug approach is way more effective at suppressing the virus and preventing it from developing resistance to any single drug. Think of it like attacking the virus on multiple fronts.
Gotcha. And your sources break down the 5 main classes of drugs that are used in ART, right? You've got nucleotide reverse transcriptase inhibitors, so those are the NTRTIs.
Right.
You've got the non-nucleotide reverse transcriptase inhibitors, the NNRTIs,
Right.
protease inhibitors,
Yep.
entry inhibitors,
Uh-huh.
and integrase inhibitors, plus some other kind of less commonly used antivirals.
Right, right.
So let's dive into like a couple of specific examples from your sources here.
Okay.
We'll start with the NTRTIs. Epcavir, also known as Zeagan, is one example that's mentioned. How does this particular class of drugs work?
Okay, so NTRTIs like abacavir, they work by mimicking the natural building blocks that HIV needs to create its DNA during reverse transcription.
Okay.
So when the virus is trying to replicate, it mistakenly incorporates the NTRTI instead of the real building block. So it basically creates this defective DNA strand, and it stops that viral replication process in its tracks.
It's like sabotaging the virus's blueprint almost.
Exactly. Yeah, it's like giving the virus faulty building material so it can't complete its little construction project.
That's a great analogy.
And interestingly, your sources point out that abacavir also has a specific use in post-exposure prophylaxis for healthcare workers who might have been exposed to HIV.
Okay, so if there's, like a needle stick or something like that,
Exactly.
it can be given to kind of like prevent the infection from taking hold.
Right, right.
And with all medications, of course, there are potential downsides.
Of course.
So what are some of the adverse effects and, warnings that are associated with abacavir?
Yeah, so your sources list a number of potential adverse effects. There's anemia, which is a low red blood cell count.
Oh, yeah.
Neutropenia, which is a low white blood cell count, which can increase your risk of infections.
Right.
There's loss of appetite, nausea, diarrhea, fatigue, and just kind of a general feeling of weakness. And at higher doses, it can have some toxic effects on blood cells.
Oh.
There's also this black box warning for a really rare but very serious condition called fatal lactic acidosis with hepatomegaly, which is where lactic acid builds up in the blood and the liver gets enlarged.
Yeah.
And long-term use has also been linked to myopathy, which is basically muscle disease.
Okay. And I'm assuming there are certain, contraindications, situations where you just shouldn't use this drug.
All right, exactly.
And some important nursing considerations.
Yeah, so abacavir generally isn't prescribed to patients who already have anemia or neutropenia because it could, make those conditions worse. It's also contraindicated in individuals who are taking other drugs that can suppress bone marrow function. And nurses need to be aware that the drug can accumulate to toxic levels in patients with kidney or liver problems.
Okay.
So frequent monitoring of blood counts is really important.
Makes sense, yeah.
There are some interesting drug interactions, too. For example, it's generally advised to avoid taking abacavir with fruit juice.
Really?
Yeah, because it can sometimes increase those lab levels of MCV, which is a measure of red blood cell size. Okay, although the clinical significance of that isn't entirely clear. And St. John's wort, which is this herbal supplement that some people use, may actually decrease the effectiveness of abacavir and other antiretroviral drugs.
Okay.
And finally, it's classified as pregnancy category C, meaning we don't have a ton of information about its effects on a developing fetus.
Okay, so caution is advised there.
Absolutely.
Okay, let's move on to the next class of drugs here, the NNRTIs.
Okay.
Efavirenz, also known as Sustiva, is mentioned as kind of the prototype for this class.
Right.
So how does its mechanism of action differ from the NTRTIs?
Okay, so NNRPIs, like efavirenz, also target that reverse transcriptase enzyme.
Right.
But they do it in a slightly different way. Instead of mimicking the building blocks,
Right.
efavirenz actually binds directly to a specific site on the reverse transcriptase enzyme itself.
Okay.
This binding actually changes the shape of the enzyme and stops it from working properly.
So it's kind of like gumming up the works.
Exactly, yeah.
Okay.
And this prevents that creation of viral DNA.
Right.
And your sources point out that efavirenz is often the preferred drug for initial HIV therapy because it's generally well tolerated and it has a lower risk of the virus developing resistance to it compared to some other drugs.
Okay, so it's kind of a good first-line agent.
Yeah, it's often a good choice for that initial treatment.
Okay, what about potential side effects and, things that healthcare providers need to be aware of when they're prescribing it?
Yeah, so common adverse effects of efavirenz can include skin rash
Okay.
and a range of central nervous system effects. So things like sleep disturbances, difficulty concentrating, unusual dreams, confusion, and dizziness.
Yep.
And your sources note that these central nervous system effects can be made worse by alcohol consumption or the concurrent use of other medications that affect the central nervous system,
Oh,
like certain antidepressants or anti-anxiety drugs.
so those need to be monitored very carefully.
Absolutely, yeah. And another important point is that high-fat meals can really increase the absorption of efavirenz, which could lead to higher drug levels and potentially more toxicity.
Okay, so maybe take it on an empty stomach.
Exactly. It's usually recommended to take on an empty stomach, often at bedtime,
Okay.
which can also help to kind of minimize those daytime central nervous system effects.
Okay, that makes sense.
Nurses also need to monitor patients for the development of a rash,
Right?
because in rare cases, it can be really severe.
Yeah.
And efavirenz may also increase the risk of seizures in people who already have a seizure disorder.
Okay.
So that's something to keep in mind as well. And similar to abacavir, St. John's wort can also decrease the activity of efavirenz, and it's also pregnancy category C.
Okay, so we're seeing some common themes emerging here, yeah.
Right, there are definitely some common threads.
Now, the third class of HIV drugs mentioned in your sources are the protease inhibitors, with lopinavir combined with ritonavir, also known as Calatrava, as kind of the example drug.
Right.
What part of the virus's life cycle do these drugs target?
Okay, so protease inhibitors like lopinavir, they block this crucial viral enzyme called protease.
Okay.
And this enzyme acts like a pair of molecular scissors that HIV needs to cut these large, non-functional viral proteins into smaller functional proteins that are essential for assembling those new infectious viral particles.
Okay.
So by inhibiting protease, you're basically preventing the virus from maturing and becoming capable of infecting other cells.
Oh, wow.
Calatrava is this combination drug,
Okay.
where lopinavir is the active protease inhibitor,
Right.
and ritonavir is another antiviral drug that acts as a booster.
Okay.
So ritonavir inhibits an enzyme in the liver that would normally break down lopinavir.
Okay.
And so it increases the levels of lopinavir in the body and makes it more effective.
So they work better together.
You work much better together, yeah.
Okay, this combination is also often preferred for initial HIV therapy.
It often is, yeah.
Okay, what are some of the common adverse effects and, contraindications associated with this particular combination?
Okay, so your sources list several potential adverse effects, including nausea, vomiting, indigestion, diarrhea, fatigue, headache, and high blood sugar, which is also known as hyperglycemia. Long-term use of protease inhibitors has been associated with something called lipodystrophy syndrome,
Right.
which basically involves changes in the distribution of body fat.
Okay.
And then in rare cases, you can see pancreatitis, which is an inflammation of the pancreas.
Okay.
And there are some important contraindications too. Lopinavir ritonavir should generally be avoided in patients with significant liver impairment,
Okay.
as it could potentially lead to liver failure.
Oh, wow.
It's also contraindicated in individuals with certain types of heart disease
Okay.
because it can affect the electrical activity of the heart.
Okay.
It can also interact in dangerous ways with statin medications, which are those drugs that are used to lower cholesterol,
Okay.
increasing the risk of muscle damage,
Right.
and also with certain antiarrhythmic drugs, those drugs that are used to treat irregular heartbeats. It can potentially lead to life-threatening heart rhythm problems.
So that's a big one.
Yeah, those are some serious drug interactions.
And are there any other, nursing considerations or drug interactions, things like that?
Yeah, if the oral solution of lopinavir ritonavir is being used, it should be given with food
Okay.
to enhance its absorption.
Okay.
Nurses also need to monitor patients who are also taking certain other medications, like those SSRI antidepressants, the tricyclic antidepressants, and phenothiazines,
Right.
because lopinavir ritonavir can sometimes increase the levels of those drugs in the body, which increases the risk of side effects.
Okay.
It can also lead to increases in lab values of cholesterol and triglycerides.
Right.
And similar to the other HIV medications we talked about, St. John's wort can also decrease the activity of lopinavir ritonavir,
Okay.
and again is classified as pregnancy category C.
Okay. All right. Let's shift gears now and talk about some other viral infections that are covered in your materials. Since herpes virus is mentioned, which, those recurring blister-like lesions are unfortunately a common experience for many people.
Yeah, unfortunately.
Now, herpes viruses are a family of DNA viruses.
Right.
And your sources point out that, you've got herpes simplex virus,
Right.
HSV, you've got varicella zoster virus, which causes chickenpox,
And shingles.
and shingles.
Right, which is the reactivation of that same virus.
Yeah, it's so interesting.
Yeah.
Now, while antiviral drugs can't actually get rid of the herpes virus from the body,
Right.
they can help manage these infections.
Absolutely. They can lower the frequency and severity of those acute episodes.
Right.
They can help relieve the symptoms during an outbreak and even be used to prevent recurrences in some cases.
Okay.
But it's really important to remember that these drugs are suppressive.
Right.
They're not curative.
You can't get rid of it.
You can't get rid of it, unfortunately.
Okay. And acyclovir, also known as Zovirax, is given as an example
Right.
of an antiviral that's often used to treat herpes.
Right. It's an older medication, but it's still very effective.
It still gets the job done.
It does, yeah.
So what are its key characteristics?
So a cyclover can be given orally, topically, as a cream, or intravenously. Your sources highlight that intravenous acyclovir can carry some risks, including potential kidney damage, also known as nephrotoxicity,
Okay.
and neurotoxicity, which can affect the nervous system. So it's generally contraindicated in patients who are also taking other medications that could harm the kidneys because obviously that increases the risk of kidney damage.
Right.
It should also be used cautiously with probenecid, which is a medication that's sometimes used to treat gout, because probenecid can decrease the elimination of acyclovir from the body,
Okay.
which could lead to higher drug levels and an increased risk of side effects.
Right.
Nurses are often advised to administer acyclovir around the clock, even if it means waking the patient up in the middle of the night,
Wow.
to maintain those consistent drug levels in the body. And oral forms should typically be taken with food. And interestingly, using it at the same time as zidovudine, which is an NTRTI that's used in HIV treatment,
Right.
may increase drowsiness and lethargy.
Oh, okay.
So that's something to keep in mind as well.
Right. So potential for interaction there.
Absolutely.
Acyclovir can also potentially increase the levels of those markers of kidney function, the BUN and creatinine.
Right.
So obviously monitoring those is really important.
Especially in patients with pre-existing kidney issues.
Right.
Yeah, and acyclovir, just like many other antivirals, is a pregnancy category C drug.
Okay, so that seems to be like, par for the course here.
It's a pretty common theme.
Okay, influenza, or the flu, as we all know it,
Right.
is another very common viral infection that your sources cover.
Right.
And they make it very clear that the best line of defense is vaccination.
Absolutely. Yeah.
But what about treatments, antiviral treatments specifically, when someone does get sick?
Right. Well, getting vaccinated every year is definitely the most effective way to prevent the flu and all its complications. But antiviral drugs like oseltamivir, also known as Tamiflu, can be helpful in certain situations.
Okay.
Like they can help prevent infection in people who have been exposed to the flu, for example, in a household where someone's already sick.
Okay, so you can kind of take it as a preventative measure.
Exactly, yeah. Or if you do get sick and you start taking it within the first day or two of symptoms, it can actually reduce the severity of the flu and shorten how long you're sick for.
Okay.
And oseltamivir works by inhibiting an enzyme on the surface of the influenza virus that it needs to spread to new cells.
So it's kind of like blocking its escape route.
Exactly.
Common side effects, though, right?
Yeah, common side effects can include things like nausea, vomiting, diarrhea, and sometimes dizziness.
Okay.
So not fun, but usually manageable.
And anything that, providers should be cautious about when they're prescribing it.
Yeah, caution is advised when using oseltamivir in individuals with significant kidney dysfunction, and its use in breastfeeding women should be carefully considered as well.
Okay, all right. So the next thing covered in your materials is viral hepatitis, which, of course, involves inflammation and potential damage to the liver.
Right.
And your sources mention, hepatitis A, B, and C.
Yeah.
And, I'm assuming there's some key differences there.
There are, and your sources point out that we've got these great vaccines available for both hepatitis A and B, which has really significantly reduced the number of these infections we see.
Right.
Unfortunately, we don't have a vaccine for hepatitis C yet.
Right.
But for individuals who have been exposed to hepatitis A or B and haven't been vaccinated, or those who need immediate short-term protection,
Right.
we can give them hepatitis A or hepatitis B immunoglobulins, which provide that passive immunity.
Okay.
Hepatitis C is typically treated with a combination of antiviral medications, including interferons,
Right.
and other direct-acting antiviral drugs like ribavirin.
Okay.
And thankfully, the specific treatment for hepatitis C has advanced so much in recent years
Oh, good.
that we can often cure it now,
Oh, that's amazing.
which is great. Chronic hepatitis, regardless of the type, is generally managed by treating the symptoms and trying to prevent further liver damage.
Okay, that makes sense. And finally, we come to coronavirus, and specifically COVID-19, with remdesivir, also known as
Okay.
Veklury,
Yeah.
highlighted as an antiviral.